Welcome back to The Explainer. Today, we're diving into a genuinely fascinating, kind of unexpected crossover between medical science and personal wellness. We are talking about a clinical breakthrough for a pretty sensitive topic, premature ejaculation, or PME. Now, when most of us hear the word BOCOX, our minds immediately go straight to cosmetic clinics, right? Smoothing out forehead wrinkles. But today, we're looking at some hard clinical data that shows how this famous muscle relaxant is actually being repurposed down below to solve a very real, frustrating functional issue. Get ready to rethink what you know, because the science here is just incredibly clever.
Here is our roadmap for today. 1. A new PME alternative. 2. The deep injection technique. 3. Analyzing the results. And 4. Safety and side effects.
Section 1. A new PME alternative. When SSRIs fail. So for a lot of patients dealing with PME, the standard first line of defense is usually SSRI medications, which are basically antidepressants used off-label, or maybe some topical numbing creams. But what happens when those just don't work? Or, what if a patient builds up a resistance to them over time? It creates this incredibly frustrating cycle. The medical community realized that patients with treatment-resistant PME really needed a completely new approach. They needed a functional, structural intervention, not just a systemic chemical one. And that is exactly where BOCOX enters the chat, not as some cosmetic enhancement, but as a highly precise, localized, muscle-relaxing medical tool that's literally designed to delay that physical reflex.
And we actually have synthesized data from a recent Thai clinical source that shifts this whole conversation from anecdotal hope straight to measurable reality. It completely proves that there is a legitimate, data-backed, functional alternative for guys who just don't respond to standard meds. This breakdown of the treatment's efficacy really forms the foundation of our understanding today. It shows us that for this specific demographic, men resistant to SSRIs, a targeted Botox treatment isn't just some wild experiment. It's a highly structured clinical pathway with really quantifiable outcomes.
Moving right along to Section 2, the deep injection technique, a painless approach.
To understand why this works so well now, we kind of have to look at why early attempts actually failed. As outlined by our Hindi clinical source, the old method relied on superficial injections. Basically, clinicians were administering the Botox way too shallowly, and because it didn't reach the target muscle, it was pretty much ineffective and honestly often quite painful. But the pioneering new method changes the game completely. It uses a specialized technique that focuses exclusively on a deep muscle injection. The clinician absolutely must reach the actual muscle responsible for that physical reflex if the Botox is going to do its job. So hitting that deep muscle, that is the absolute key to success here.
Okay, so you might be wondering, how on earth is this done without causing immense discomfort? Let's walk through the actual clinic chair experience step by step. Step 1 is the administration of local anesthesia. This is totally non-negotiable. Step 2 is all about patience. The clinician literally just waits until the area is completely 100% numb. Once full numbness is locked in, we hit Step 3. Because the patient feels absolutely nothing at this point, the clinician can safely use a thicker syringe. And as our clinical source emphasizes, you actually need that thicker syringe to navigate deeply enough to touch and enter the target muscle. Sounds a little intimidating, I know, but the combination of anesthesia and this precise technique makes reaching that deep muscle completely painless.
Section 3. Analyzing the results. Hard clinical data.
So let's talk about the data, which reveals a truly dramatic increase in duration. We're talking a massive 3 times multiplier right in the very first month post-treatment. According to the Thai clinical data, patients in the Botox injection group went from an average baseline of just 35 seconds prior to treatment all the way up to an average of 105 seconds after. I mean, mathematically, that is a massive leap. It perfectly shows how relaxing that specific muscle mechanically interrupts the rapid reflex loop that characterizes PME.
But you're probably asking, how long does this actually last? Let's map out the 6-month efficacy curve from that same clinical data. Between months 1 and 3, patients experience the peak, absolute clearest clinical results. The muscle is fully relaxed. Then, moving into the 3 to 6 month window, the efficacy gradually begins to decrease. And actually, this is completely standard for Botox anywhere in the body. Finally, right around the 6-month mark, the efficacy fades out entirely as the Botox dissolves and is safely, naturally absorbed by your body. So it's a highly predictable temporary intervention with a very clear timeline.
Section 4. Safety and side effects. A complete picture. Now, whenever we discuss medical interventions in this specific anatomical area, the primary concern is obviously collateral damage. Will fixing one problem end up creating a worse one? Well, the clinical consensus here is incredibly reassuring. This is classified as a highly safe procedure, and most importantly, the data explicitly confirms that this targeted muscle relaxation does not negatively affect a patient's natural ability to achieve or maintain normal erections. Because the Botox is zeroing in on the specific mechanism of ejaculation, it just leaves the vascular mechanisms needed for an erection completely undisturbed.
To give you the full, complete picture, we have to look objectively at side effects. A massive 91.5% of patients reported absolutely no side effects whatsoever. They just experienced the benefits. Now, 8.5% did experience minor side effects, with the most common being a temporary issue with intermittent urination. It is a small minority, sure, but it's important to point out that even for this 8.5%, those side effects were completely temporary and fully resolved on their own as the body adjusted to the medication.
And this brings us to what I personally think is the most fascinating takeaway of all. Our Hindi clinical source highlighted an unbelievable psychological benefit. They noted that over that 6-month window of successful treatment, many people's physical and mental habits literally change. See, PME is so often this vicious cycle of performance anxiety triggering the physical reflex, right? But when Botox essentially forces your body to slow down for half a year, your brain actually relearns the process without that anxiety loop. Because of this profound habit-breaking window, many patients find that their PME is practically cured, and they never actually need a top-up injection once the 6 months are over. It really acts as both a physical treatment and a psychological reset button.
We literally took a substance famous for freezing forehead wrinkles, applied a hyper-precise deep injection technique, and used it to break a debilitating physiological cycle. It really makes you wonder, right? Beyond PME, migraines, and muscle spasms, what other surprising, life-changing medical applications might Botox unlock in the future? Thank you so much for joining me for this explainer. Keep asking questions,